Welcome to today's presentation. Today, we're focusing on some key lung sounds that can help us assess patients with chronic heart failure. As you listen to the lungs, you might hear different types of sounds. For instance, stridor, which is a high-pitched sound often indicating airway obstruction, is not typical in heart failure. Crackles, on the other hand, are very common and are a hallmark of fluid in the lungs, especially in cases of fluid overload. Wheezes are also possible, reflecting airway narrowing, but they are less specific. Friction rubs are usually associated with pleural inflammation and are less common in heart failure. Specifically, in Mrs. Chua's case, a 78-year-old with mild chronic heart failure, the most indicative lung sound would be crackles. These sounds suggest the presence of fluid buildup, which is characteristic of heart failure. Recognizing these sounds helps us monitor the progression and manage her condition effectively. Remember, understanding these key lung sounds connects directly to providing better care for our patients with heart failure. In chronic heart failure, the main issue is that the heart can't pump blood as effectively as it should. This inefficiency causes blood to back up into the lungs, leading to a buildup of fluid, what we call pulmonary congestion and edema. When this fluid accumulates in the tiny air sacs of the lungs, known as alveoli, it changes how the lungs sound when we listen with a stethoscope. Specifically, it produces crackles, also called ralls, which are these bubbly, crackling noises. Recognizing these sounds is important because they give us a clue about what's happening in the lungs due to heart failure, and understanding this connection helps us better manage the overall condition. Crackles are a common lung sound that we often hear during auscultation. Typically, they are heard at the lung bases, which are the lower parts of the lungs. This is especially true in older adults, where changes in lung tissue and elasticity can make crackles more prominent. Additionally, patients with left-sided heart failure or chronic heart failure are more likely to exhibit crackles. This is because fluid tends to accumulate in the pulmonary interstitium and alveoli, leading to these crackling sounds. Recognizing where and when these sounds occur helps us assess the patient's underlying condition more accurately. So, understanding the typical presentation of crackles is crucial in our overall evaluation of respiratory and cardiac health. Let's take a closer look at some of the key sounds we might encounter. First, stridor. This is a high-pitched sound that indicates upper airway obstruction. It's important to remember that it's not related to heart failure, but rather issues like swelling or blockage in the upper airway. Next, we have wheezes. These are typically associated with conditions such as asthma or COPD, where narrowed airways cause that characteristic whistling sound during breathing. Lastly, friction rubs are caused by inflammation of the pleura, which is the lining around the lungs. You often see this in cases of pleurisy, and again, it's not linked to heart failure. Understanding these distinctions helps us interpret respiratory sounds accurately and avoid confusion with cardiac issues. So, to wrap things up, the lung sound most indicative of chronic heart failure is indeed crackles. When we listen to a patient with this condition, crackles are often the key clue that points us toward the diagnosis. They usually sound like fine, crackling noises, kind of like Velcro opening or Rice Krispie treats crunching together. These sounds occur because of fluid that has accumulated in the alveoli, which is a hallmark of heart failure. Recognizing crackles can really help us differentiate between different respiratory issues and confirm that the heart's inability to pump effectively is causing pulmonary congestion. This is especially important because identifying crackles early can lead to prompt and targeted treatment, improving patient outcomes. So, understanding that crackles are the most telling lung sound in chronic heart failure ties directly into the overall theme of accurate diagnosis and effective management.